Thank you for making time for Health Diary. My name is Gladys Gashanja, coming to you from the 4 Points by Sheraton here in Hurlingham. Now, if there's a time the words "the diseases of the poor" have made so much sense, must be on this episode of Health Diary. According to the World Health Organization, neglected tropical diseases persist in conditions of poverty, which in itself explains why they're referred to as neglected. You wonder what these diseases are? Well, that explanation is coming up in a moment, starting off with this fact of the matter. According to the World Health Organization, neglected tropical diseases, abbreviated as NTDs, are a group of chronic disabling infections affecting more than 1 billion people worldwide. This number is mainly concentrated in Africa, mostly affecting those living in remote rural areas, urban slums, or conflict zones. They are referred to as neglected diseases because they receive relatively much less funding or attention from national governments, medical and donor communities compared to other diseases. Beyond their negative impact on health, NTDs contribute to an ongoing cycle of poverty and stigma that leaves people unable to work, go to school, or participate fully in family and community life.
Kazi yenye nafanya mimi ni mkulima mfukaji. Nilikuwa na ugonjwa lakini sikutambua ni wa minyoo, ilinikula sana. Singeweza amka, nilikuwa najisikia niko mdhaifu. Yani nasikia tena nguvu haiko kwa mwili. Nilikuwa natematema mate, nakula sana, tumbo inafura. Ndio nikaamua nikaenda kwa hospitali. Nilipimwa, nikapatikana niko na minyoo. Daktari akanipea dawa, akaniambia vile utajisikia uko salama, usisahau kuja hospitali. Ukuje baada ya miezi 3. Na nilifuata. Nimefuata hiyo masharti. Nilipona nikasahau kabisa. Sasa naendeleanga tu na hiyo miezi 3. Hata familia yangu ikakuwa mzuri. Hata chakula yenye tulikuwa tunakula kwa mwezi, tulirudi tukashukisha. Sasa tunakula vizuri kabisa. Sasa appetite zikarudi vizuri. Hatukuli sana vile tulikuwa tunakula mbeleni. Huu ugonjwa ni ugonjwa wenye unatipika. Ukienda hospitali utapata nafuu. Alafu nitawasaidia tu ya kwamba wawe na maji karibu na msalani na sabuni. Alafu wachunge watoto wasikule mchanga. Wakitoka choo wananawa mkono vizuri. Wachunge watoto wasikule chakula baridi. Aliniambia nikitoa hata viazi kwa shamba au mboga, nihakikishe nimeosha, tena nimeosha vizuri kabisa. Na sasa washauri tu wenzangu wenye wako kwa vijiji, muende hospitali, mpeleke watoto hospitali. Usafi wa vyombo ambavyo tunavitumia, tunahakikisha iko safi. Hizo vyombo tunaosha na maji mara 3. Unatoa uchafu, alafu ndio unaanza kuosha, ndio unakamua. Alafu uhakikishe umeiweka juu, ukuwe na, sisi huku risafu tunaita kitarasi, yani sieve. Ikuwe juu, isikuwe chini, kwa sababu ukiweka chini tena mayai inaweza kuwa iko hapo chini, na saa ile unachukua kikombe kutoka hapo chini ukienda kunywa maji au chai, mayai pia inarudi.
So let's learn more about neglected tropical diseases. And we have Wycliffe Omondi, who is the head of Department of Vector-Borne and Neglected Tropical Diseases at the Ministry of Health. Also joined by Daniel Kurao, who is the manager at the WASH and NTDs program at Amref Health Africa. Gentlemen, karibuni sana. Now, we are speaking of neglected tropical diseases, but Wycliffe, first of all, let's understand, what are tropical diseases?
Neglected tropical diseases are a diverse group of conditions. The listing is usually provided by World Health Organization, WHO, and currently there are 20 infectious as well as non-infectious conditions under the umbrella of neglected tropical diseases. Of the 20, about 19 are present in the country. They are majorly affect the most vulnerable community members, those who are poor, those who lack access to water, those who lack access to sanitation as well as hygiene.
So when you say tropical, why are they named tropical? What about them makes them tropical?
What makes them tropical? Basically, they occur along the tropical belt of the world.
You have mentioned those that are unique to the country. Which are they?
The 20 would start with soil-transmitted helminths or intestinal worms, bilharzia or schistosomiasis, elephantiasis, lymphatic filariasis, in other words, the blinding trachoma. Currently, river blindness or onchocerciasis is no longer of public health importance in the country, as well as human African trypanosomiasis or sleeping sickness. We have leishmaniasis or Kala-Azar.
Which is?
Kala-Azar is a parasitic disease occurring in arid and semi-arid parts of the country, mostly transmitted by small insects called sandflies. It affects both the skin, which we refer as cutaneous leishmaniasis, as well as the internal organs, such as the liver, which we refer to as visceral leishmaniasis. We also have hydatid disease or echinococcus, mostly in parts of Turkana and the Masai Mara corridor. Snake bite. Leprosy, we have rabies, mycetoma. Currently, we do not know of the distribution of mycetoma in the country, as well as yaws and Buruli ulcer. We have reports of foodborne dermatodiasis. We also have scabies and other ectoparasites. The part of ectoparasite may be what we know is jiggers. We also have in the country the presence of cysticercosis or tiniasis. Geographically, we don't have Chagas disease since it is limited in the American regions. Dengue fever and chikungunya also occurring in most of the coastal northern parts of the country.
Okay, so Daniel, are these tropical diseases unique to Kenya or they mirror other burdens in the continent?
It is tropical, so really it is not Kenya alone, but it's about the tropical regions which cuts across many countries in Africa.
Why do you refer to them as neglected diseases?
They tend to be diseases that affect those people that I would also want to call neglected in quotes in society. These are people who are poor. These are people you'll find not mingling with many other Kenyans. And again, these are diseases that also take a bit of time before we can come to diagnose that people are suffering from these conditions.
Some of the questions we ask ourselves is that despite the fact that we know that we need to routinely deworm ourselves, how many take the initiative to deworm themselves? So the neglect starts with us and rise through the leadership ladder. And that neglect, because they also affect the poor, we do not want to invest in treatment therapies to the poor because we may not recoup the profit as in other diseases.
Now, Wycliffe, let's understand the burden of NTDs in Kenya. Approximately how much of a population would you say is affected by NTDs?
Now, these diseases are focalized in the country. The problem in coast may not be what is in the Lake Belt region, is not what is in arid and semi-arid areas. So that means that if I attempt to provide some numbers, I need to go disease by disease probably. But from magnitude part of it, I would say that 1 in 2 Kenyans are affected by neglected tropical diseases. However, for each and every specific disease, we can provide breakdown of the burden. For example, elephantiasis is only restricted in the coastal region of Kenya, where we have about 4 million people.
So counties in the western and coastal regions seem to feature a lot on the most affected list. What do they have in common?
Yeah, for example, if you look at the western, first of all, it is a wet region. It is a farming community. So if you look at things like soil-transmitted helminths, for example, These are parasites that also have a circle that is linked to how we harvest our food and how we prepare our food. Other parasites, such as those that we get through animals, again, it is very common with communities that do a lot of pastoral work or pastoralists. If you look at the coast again, it is about lymphatic filariasis, and again, it's common because it is warm. It is about that species of mosquito that also thrives well in warmer regions.
Okay, so we're talking about Kakamega, Vihiga, Trans Nzoia, Bungoma, Mombasa, Kilifi, Kwale, Taita Taveta, Tana River, and Lamu. And we mentioned NTDs generally afflict the world's poor. What are we saying about these counties, Wycliffe?
The environment plays quite a critical role for these parasitic infections to thrive in certain areas than the others. Now, the counties that you've highlighted, the environment plays a bigger role for establishment between the parasite and the infection into the people. So as much as, again, we are saying it is the disease of the poor, but then you look, if you were to profile the section of the community, then you will find it again, you will be in the coast, or you will be in the western region, or maybe in the Lake Belt region, then you will again see where is the positivity rate highest. So that is why we are saying the poor, if you were to do some positivity in terms of prevalence, then you will find that the poor people are the ones who are mostly affected.
So, Daniel, are we saying elephantiasis, trachoma, bilharzia, intestinal worms, and others, that they have a common way they're spread or their causes?
Not really. I mean, they have different diverse way of spread, for example. If you wanted like to mention trachoma, it is more of hygiene related. It thrives in, it is common in communities that lack water, communities that are living in conditions where we also have lots of flies that help in transmitting the pathogens. These are conditions, again, that can be prevented.
Okay, earlier you mentioned that there are mosquitoes involved, others there are flies that are involved. What else?
If you look at bilharzia, you will talk about snails. So, and this you will see in regions such as even Kirinyaga, because there is a lot of farming and communities are wading in water to plant rice and things like that. So it becomes common. So as we mentioned environment, how do you interact that environment and what is in that environment? And then again, we have the habits that again, when you are farming, maybe here and there you pick a piece of a carrot and sometimes you don't even wash. So it becomes an opportunity of transmitting some of those soil transmitted health means.
Okay, we take a short break here on Health Diary. When we return, let's find out who is at risk of contracting NTDs. Stay with us. Welcome back. NTDs, neglected tropical diseases, is the conversation of the day. We still have Wycliffe Omondi, who heads the Department of Vector-Borne and Neglected Tropical Diseases at the Ministry of Health, and Daniel Kurau, who is the manager at the WASH and NTDs program at Amref Health Africa. Gentlemen, thank you for giving us more perspective on NTDs. Now, Daniel, when we talk about who is at risk of contracting NTDs, I see the WHO speaking a lot about children. Why children?
Children at some stage, of development, are crawling, and they could be walking and they are picking anything and they are putting to their mouths. Again, in many communities, and even for development and for balancing, in most instances, walk without shoes, you see. And any part of the body that is now open is also another opportunity for these conditions, particularly the parasites, to penetrate the body. And again, children will not be in a position to practice their personal hygiene. So it depends on the caregiver. So if in situations where caregivers also lack the information, lack the water, Sometimes they don't even have the soap to clean the children. Now adds into that still burden of children becoming much more in the category that get affected with these conditions.
So apart from ill health, how do NTDs impact on the community?
For instance, for elephantiasis, you acquire infection today, you start seeing symptoms 10 years later. So that means from now you will be doing your daily chores. But when the symptoms begin, the swelling of the leg, it gets to an instant where you are disabled. When you are disabled, your foot is as big as that of an elephant, then probably you are not able to bring any income generating to your family. You should be having a family at that particular level. You will be depending on your extended family. Probably your parents will be also be old and expecting. So you find that the poverty is being perpetuated. I'm just giving an example of elephantiasis. The same, it only doesn't affect the legs, it also affects the genitals, and you will find that there are men with testes as big as 20-liter jerrycan. So at that level, you are not able to productively engage yourself. So there is that economic link to NTDs. Stigma definitely sets in. When your foot is that big, you are stigmatized. Of course, it also leads to some mental health issues. We look at intestinal worms. These worms feed on the little nutrients that when you uptake your food, they also feed on it. So there's malnutrition that sets in. And that malnutrition, we are saying they are occurring in a poor setup. So what is the repercussion of this malnutrition? It leads to anemia, and of course, they also impair the cognitive nature of the affected individual. So at the end of the day, when we expected very bright people, then you don't become that bright, then consequently, then our nation will not be producing those geniuses that we are looking into.
Okay, and what are some of the challenges perhaps you face trying to prevent or control the spread of NTDs?
People don't come out to speak. That is one of the most difficult challenges. Then because it is a disease that we tend to neglect ourselves, then even in programming, we don't sit, we don't have an opportunity to plan and push for resources that target to have these communities' health needs addressed.
Away from now the stakeholders and what they should do, how about on a personal responsibility? What challenges do you face?
The tendency of our communities to believe that hand washing is not a priority is the biggest challenge. And even this happens even from those of us who are even learned. Many a times you will get people greeting several times and they can still eat without even washing hands. So one of the things is that we neglect and we think that hand washing is not important. And that is the greatest challenge. The other challenge is you will pass the information, you educate the communities, but they'll come and say, okay, now I agree, but I don't have the ability to buy soap and I don't have access to water. It becomes challenges. So those are some of the things that need to be addressed.
Okay, so Wycliffe, stakeholders in the NTD space are looking at 4 particular NTDs: bilharzia, elephantiasis, trachoma, intestinal worms. Are these more of a problem than the rest?
They are termed as preventive chemotherapy, the ones that I can give medicine in mass to lower the prevalence so that we achieve we eliminate it as a public health concern in the country. Again, you look at these 4, the number of people who are at risk is bigger than these other ones. So that is why the concentration is much on the 4 PCNTDs. But as I indicated, we are looking into elimination roadmap as a country in line with the global framework.
All right, and health is a devolved unit. How, as a ministry, are you perhaps building the capacity of the 10 affected counties to deal with NTDs?
Each disease has got its own parameter. So for elimination to be achieved, the silver bullet is that I give mass treatment in area where I have determined. Now again, some of the challenges, you give these free medicines and people don't want to take them simply because they say, I don't have the worm. But when did they get tested to know whether they have them or they don't know? So we provide free treatment in these endemic areas. But before we provide that free treatment, the national team capacity built in its mandate to provide capacity building to the county. And of course, when we are now doing the monitoring of interventions, how effective is our intervention? So we do assessment by testing and seeing has the positivity rate gone down, or was it effective or not? What is it that we need? Sometimes if we safely contain our human excreta, then probably we won't need the dewormers, be it urine or the fecal content. So if we are to strengthen the wash component, then probably we may not need to provide the community members with the medicines. 3, sometimes you can provide those water, sanitation and hygiene, but people don't want to use them. So if we can engage the endemic communities in behavior change and communication, then it would be a great way of also moving forward.
Daniel, as we bring this conversation to a close, you're the private player in this. What more needs to be done to help upscale interventions in NTDs?
We need to come with the knowledge that it is not work that is going to be done, for example, by the Ministry of Health alone. It is work that requires all partners, requires collaboration. And it is work that also requires a very active participation by the beneficiary community. So all need to direct efforts towards this disease prevention and control.
Now, there is a date to this last mile, 2023, at least for the 4 that you mentioned. Is it possible, Wycliffe, by then?
If you look at the Kenya National Strategy for Breaking Transmission of the 4 preventive chemotherapy NTDs that we highlighted, it was launched in 2019. So when we talk about 2023, it was a 5-year program. But you will realize that 2019, when we launched this particular great initiative, COVID set in 2020. So some of the planned intervention could not be rolled out until 2021. So probably we may see a shift from 2023, and we are not really going beyond 2026. So there may be shift in terms of timelines, but not such a drastic one. Of course, in 2020 when it started, it was a worry that maybe the gains we had achieved prior would be erased. But as the COVID-19 infection continued, then we had to find a mechanism how to work within the COVID-19 situation. So currently we've rolled out a mechanism to protect both healthcare service providers to the community members, to protect themselves as healthcare, and also protect the community members from acquiring COVID-19 infection. That is how we've packaged ourselves, and we are able to navigate and maybe continue providing community members with these essential services even during the COVID-19.
Underscoring WASH has been the silver lining to COVID-19. How are you reaping benefits for the NTD sector?
Automatically, if we keep washing our hands, then of course there's a direct preventive measure towards acquiring the NTDs. But I wouldn't say currently that there's a study that have given that as a fact that this is the quantity of benefits we are deriving from the COVID-19 prevention measures that are in place.
Thank you, gentlemen. Wycliffe Omondi, Head, Department of Vector-Borne and Neglected Tropical Diseases at the Ministry of Health, and Daniel Kurao, who is the manager at the WASH and NTDs program at AMREF Health Africa. I think this was such an eye-opening conversation around neglected tropical diseases. Time now for a health tip.
To our elderly parents and grandparents, even as you do other medical appointments, it is very important that you visit the dentist during that time so that we can preserve those teeth. In cases where they have missing teeth, there are many options of replacement, and where they have all the teeth missing, we usually give them dentures, and dentures will enable them to have the correct speech, they'll enable them to have the correct aesthetics, and most importantly, they'll be able to function by eating. Dentures should be well taken care of, just like the natural teeth that we usually have. They should be kept clean and they should be properly fitting. When they do not fit properly or where they are pinching, the patient should be able to go to the dentist so that they can get adjusted so that they are able to use them.
A lot of information about neglected tropical diseases on today's episode of Health Diary. Thank you for keeping us company. My name is Gladys Gashanja, coming to you from the 4 Points by Sheraton here in Hurlingham. Until next time, see you